Okay, welcome back. I hope you're all having a great week. Today, we're continuing our RBT exam practice question series where we're going through 10 RBT questions and breaking them down, how you should think about them on your actual exam. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out rbtexamreview.com for all of our study materials. We offer 3 full practice exams, a task list study guide, and our combo pack, which comes with everything. We also have our competency study guide for your initial and your renewal. Congratulations to those, including Judy and Tammy, who recently passed their exam. Let us know when you pass so we can include you in our Sunday shout out. Questions, comments, let me know. Love to help. Other than that, let's work hard, let's study hard, and let's get to our questions. Question 1. Miss Susan, a first grade teacher, is talking with a BCBA about one of her students. Miss Susan tells the BCBA that the student runs away from the classroom usually 3 to 4 times a day. Miss Susan says the behavior usually occurs when she turns around to write on the board. When talking about turning around to write on the board, Mr. Susan is describing a what? All right, so we have a behavior question. And with behavior questions, it's very important that we start to identify the learners or the active responders, the antecedents, the consequences, all of our necessary pieces to behavior, because we have a lot of information here. And we really want to hone in on what's important. So start by asking yourself, what does the question want to know? The question wants to know about Miss Susan's turning around to write on the board. What is Miss Susan describing when she talks about turning around to write on the board? Well, if we look before that, Miss Susan says the student runs away from the classroom, and she says the behavior usually occurs when she turns around to write on the board. So is Miss Susan's behavior happening before or after the student running away? What's happening before? And what comes before a behavior? An antecedent. Miss Susan is most likely describing an antecedent to the behavior when talking about turning around to write on the board. If we look at a function, what are our 4 functions? Our 4 functions are tangible, escape, attention, and automatic. We're not really necessarily concerned with the function of the student's behavior. We're strictly talking about Miss Susan's behavior of turning around to write on the board. And we don't know the function of that. And it doesn't matter what the function of that is, okay? Because we're talking about it in relation to the student running away. So we're not describing a function, or Miss Susan's not describing a function. What about topography? Topography is a description of what the behavior looks like. Now, we know Miss Susan turns around to write on the board, but we don't get a really detailed description of this behavior. And again, it doesn't really matter, okay? Because Miss Susan is telling us this. Why? She's telling us this why? Because she's explaining what happens before the student runs away. And again, when we talk about what happens before a response, we're talking about an antecedent. And if we see C, that is going to be our answer. Why is it not a consequence? Well, a consequence occurs after the behavior. So if Miss Susan told us what she did in response to the student running away, we'd be describing a consequence. Miss Susan is telling us what she does before the student runs away, before being the key word. Miss Susan is describing an antecedent. Make sure when you do behavior questions, you really pinpoint what the question wants to know in relation to what behavior you're looking at. In this case, we're looking at Miss Susan's behavior in relation to the student. Miss Susan turning around is the antecedent to the student running away. Kevin, an RBT, is told to observe the client's on-task behavior for 20 minutes of each 3-hour session as part of a discontinuous measurement procedure. How would measurement most likely take place if Kevin were using a partial interval measurement system? What does the question want to know? The question wants to know, how would this work if Kevin were using a partial interval measurement system? So what is a partial interval measurement system? Well, we're taking a chunk of time, we're breaking it into intervals. If the behavior occurs at all during each of our interval, it counts as a response. Partial interval measurement. What do we know so far? Well, we know Kevin's going to be taking behavior data for 20 minutes. His full session is 3 hours. Okay, so 20 minutes is our segment. But we still need to do what? We still need to break this 20 minutes down into intervals. That's the whole point of interval measurement. You take a chunk of time and you break it into intervals. It doesn't do us any good to take partial interval data for a full 20 minutes, because if the behavior occurs at all in the 20 minutes, we're going to have one response. That's why for interval systems, interval measurement, we take that chunk and we break it down into typically, 30-second, 1 minute intervals. That being said, let's see if we have a scenario like that, because we're trying to figure out if Kevin is going to use partial interval, how would it work? A, Kevin would observe the behavior for the 3-hour session and record when the behavior occurred. Now, why is this wrong? Well, we were looking at a discontinuous measurement procedure here. If Kevin takes behavior data for the entire session, that's going to be continuous measurement, and that's not what we're looking for. A is out. B, Kevin would observe for 20 minutes. If the behavior happened, Kevin would mark down one response. So we just ruled this out for what reason? Because this isn't really interval data. 20 minutes is our chunk of time. Now we need to make that into intervals, okay, to give us more data points. B gives us one data point. It doesn't really help us. B is out. C, the 20 minutes would be broken into intervals, okay? If the behavior occurred throughout the entire interval, Kevin would record a response. Careful here. If the behavior occurred throughout the entire interval, does that sound like partial interval measurement? No, that sounds like whole interval measurement. C is out. Leaves us with D. The 20 minutes would be broken into intervals. If the behavior occurred at any point during the interval, Kevin would record a response. This is perfect. We're taking our chunk of time, our sample, 20 minutes, breaking it into intervals. If the behavior occurs at any point during the interval, which is partial interval, we record a response. So our answer here is going to be D. The 20 minutes would be broken into intervals. If the behavior occurred at any point during the interval, Kevin would record a response. It's kind of a tricky question. You really need to know a lot about discontinuous measurement and about interval recording. So I'm glad we went through this. If you're confused, go back to the study guide, review discontinuous measurement. When graphing data in ABA, where do you put time? All right, super straightforward question, okay? Graphing, we use line graphs. We have an x-axis, we have a y-axis. Where do we put time? Time goes on the x-axis. Where does behavior go? Behavior goes on the y-axis, all right? And when we talk about time, okay, that means things like sessions or hours or days. You're going to put those on the x-axis, all right? Graphing questions are very rote, meaning it's a lot of memorization. Okay, a lot of the other questions are applied. Graphing, you just kind of need to know some of this stuff. You need to know time goes on the x-axis, behavior goes on the y-axis. Baseline, time does not go on baseline. Baseline is a thing. It's a segment of data, okay, before intervention begins. And then D, time is not included. That's just false, right? We're always going to have time, either sessions, minutes, hours, days, whatever we're measuring our data on, that's going to be our time. It's going to go on the x-axis, most commonly sessions. So typically you'll see sessions on the x-axis, and then on the y-axis, you'll have your behavior. Roy and Pam just broke up before their wedding. Roy now brings Pam lunch each day. Roy will ask Pam chicken or fish, and Pam will choose her lunch. What type of preference assessment is Roy conducting? Okay. What is our trick, or what is our tactic for identifying preference assessments? We ask ourselves, how many stimuli are we assessing at once? If we're assessing one stimulus at a time, it's going to be a single choice. If we're assessing exactly two stimuli at a time, it's going to be paired choice or forced choice. If we're assessing 3 or more stimuli at once, it's going to be multiple stimulus. And if we're assessing naturally in the client's natural environment, we're going to choose a free operant assessment. In this case, how many stimuli is Roy assessing at once? Well, he asks Pam chicken or fish. By my count, that is 2 stimuli being assessed at once. Pam chooses her favorite stimuli. Roy is conducting a what? Of course, that's a forced choice. We said free operant is naturalistic. This is not naturalistic. It's contrived. Roy is directly asking Pam Which one do you prefer? Preoperant is watching your client in their natural environment without intervening. And then, of course, multiple stimulus with and without replacement is going to be 3 or more stimuli at a time. Okay. Depending on which one we're using, we're either replacing stimuli or not, right? But the key is multiple stimulus with or without replacement is going to be 3 or more at a time. In this case, we only have 2. We're using a forced choice assessment. Barry signs up for an acting class. He wants to become a movie star. On the first day of class, before anything else, the teacher says, "Okay, show me what you got, Barry." What is the teacher most likely doing? If you didn't have any answer choices, okay, and we just read this question, what does it seem like the teacher wants Barry to do? She wants Barry to just demonstrate his skills. He walks in first day of class, before anything else, no teaching, no instruction. The teacher just says, "Show me what you got. Show me what you can do." And when we look at a client and we just say, "Show me what you can do," what are we doing, right? What are we trying to accomplish? The reason we want to have questions like this that aren't necessarily applied to a child with autism or a specific set of clients is because ABA is human behavior. You need to be able to apply ABA to all types of different scenarios, which is why if you want to become good at the exam, if you want to get better at the exam, throughout your day-to-day, start applying ABA terms to your own behavior. Okay, back to the question. Again, the teacher says, "Show me what you got." No teaching, nothing. What can you do? And when we ask a client to show us what they can do before teaching, what are we doing? REA, discrete trial training. Discrete trial training actually involves teaching. The teacher in this case isn't doing any instruction. She's just observing Barry. So we're not doing discrete trial training here. B, shaping. Again, shaping involves teaching. Approximations, reinforcement of approximations, not occurring. Teachers simply saying, "Barry, what can you do?" And when we ask, "What can you do?" or "Show me what you got," we are C, probing. We want to see what can you do, what can you not do. It's going to give us a good idea of what we should teach and how we should teach. That's exactly what's happening in this case. And then D, task analysis. The teacher, of course, is not breaking down any behavior into simpler steps, right? Simply asking Barry, "Show me what you got. Show me what you can do. I want to see what your skill level is at." The teacher is probing. Which of the following is not the responsibility of the RBT when delivering services? All right, that tricky little word, not. We need to read our questions carefully. We can't afford to skip over words like not. You're going to miss the question. You don't want to miss these questions. This is an easy question. So again, which of the following is not the responsibility of the RBT when delivering services? First things first, what is the RBT's primary role, your main role? Implementation. So if we look at D, implementing the plan, absolutely the responsibility of the RBT. Eliminate it. Look at A, preparing the environment. Should the RBT prepare the environment? Absolutely. RBTs, you're going to work with the client every session. Your supervisor might be out only every 2 to 3 weeks. You need to prepare your environment in a way that's going to be productive and conducive to learning. If you can't do that, you're failing as an RBT, right? Now, we have limitations because if we're working in homes, especially, we need to respect the client's environment. But if the environment isn't working for you, you need to do something about it. Okay, it's the RBT's role to prepare the environment. B, asking the parents if there are any concerns. Now, as an RBT, you can certainly chat with the parent, but it's not your responsibility, right? And you certainly shouldn't act on those concerns. Meaning, if you're talking with the parent and they say, "I'm concerned that my child is not eating enough vegetables," you shouldn't then say, "Well, I'll work on that." That's the BCBA's job. Okay. So it's not really your responsibility to check on the concerns of the parent. So far, B is a better answer than A and D. What about C? Reviewing prior sessions. Should you, as an RBT, review what happens prior sessions? Absolutely. It gives you history. It lets you know where the client currently stands. The more information, the better. So of all of these, which of the following is not the responsibility of the RBT? It's going to be B, asking the parents if there are any concerns. Your clinic primarily uses discrete trial training to teach skills to clients. Every new skill starts with a continuous reinforcement schedule, but slowly shifts to an intermittent reinforcement schedule. Why would the schedule change from continuous to intermittent? This is a very straightforward question. If I just asked you why would the schedule change from continuous to intermittent, hopefully you could tell me. We're not really worried about this other stuff. Okay. This other information is kind of meaningless. We just want to know, why do you change from continuous to intermittent? Well, continuous, as we know, is what? It's an FR1, fixed ratio 1. Every single response, we're reinforcing. Great for teaching. Why do we fade that? Why do we change to an intermittent schedule? A, intermittent is better for teaching a new skill. Well, we just said we use continuous to teach a new skill because we're delivering the most reinforcement possible. A is out. B, intermittent is naturalistic teaching. No, right? Now you could use intermittent reinforcement, and typically our behavior is reinforced intermittently, naturally. But intermittent schedule is not naturalistic teaching. Okay. You can use it, but it doesn't make it naturalistic. Intermittent works just as well for DTT. C, an intermittent schedule is effective at maintaining behaviors. Yes, when we're programming for maintenance, when we're programming for generalization, we're trying to get to a more intermittent schedule because we want our client to contact a realistic amount of reinforcement. If I'm reinforcing you every time you do something good, is that realistic? No, not compared to how the real world works. An intermittent schedule is hopefully going to present a more realistic look at how often the client's going to actually receive reinforcement. Therefore, it's going to be more effective at actually maintaining behaviors. C looks like our best answer. What about D? You should only use a continuous schedule for 2 weeks before fading the schedule. Not true. Always be careful of answer choices that are so definitive like this, right? You only use a continuous schedule for 2 weeks. It's just not true. Okay, you want to be very careful about specifics. D is just wrong. Best answer here is going to be C. An intermittent schedule is effective at maintaining behaviors. If you wanted to promote generalization with your client, which of the following strategies would most likely be least effective? All right, another generalization question. Generalization is arguably the most important part of our job. If our clients aren't generalizing, okay, we're doing something wrong. So if we want to promote generalization, how are we going to do that? Well, what is generalization? Generalization is demonstrating the skill outside of the teaching environment, meaning away from the person who taught it, away from the environment that was taught in, across different stimulus, across different environments, on and on. If we want to promote that, what should we do? In this case, we're going to try to find the one that's least effective. So A, use multiple settings and people to teach the skill. If I wanted you to generalize, wouldn't it make sense to use more than one setting and more than one person? Absolutely. A is a great way to promote generalization, not our answer. B, using the same stimulus every time you work with the client. This goes against what we just talked about. I see it all the time where we're teaching colors and we'll use a blue card and we'll use that same blue card for 3 months. We think the client knows blue, and then you introduce a blue box or a blue toy. Client has no idea what blue is. Client knows what the card is, not generalizing. Using the same stimulus every time you work with the client is setting yourself up to not generalize. B is definitely less effective than A. What about C? Reinforcing generalization whenever it occurs, even if you aren't currently teaching the client. Absolutely reinforce generalization. Just because you're not currently teaching doesn't mean you can't be delivering reinforcement. And then D, alter the learning environment regularly. Absolutely. If you work in the same treatment room every single day, change it up. All right. Change something on the wall, change the chairs. The real world is not clean. It's not pretty. It's not consistent. We have to get used to change, especially with some of our clients. So if we want to promote generalization, what will be the least effective? Using the same stimulus every time you work with the client. If you suspect that something is wrong in a client's home, Who should you report your concerns to first? Okay. This is a pretty straightforward question, right? It's just a kind of a checkup on what we're supposed to do in these situations. If you know something is wrong or you suspect something is wrong, if you've got an issue, if you got a question, comment, who do you go to first? Do you go to law enforcement, supervisor, parent, or your boss? Well, if you've been following my channel for a while, you know you're going to go right to your supervisor immediately. Okay. Always tell them first, and then we can look at this other situations. If something's going wrong in the client's home, you're really not going to want to go to the parent first. It might be them causing the issue. Your boss might be different than the supervisor. They may not know anything about the client. And then jumping to law enforcement, don't do that. Talk to your supervisor first, and then you can proceed from there. As it relates to a motivating operation, when a client does not receive enough of something, it is considered what? So we have two primary words for motivating operations. Okay. This is how we manipulate motivating operations. We either satiate on something or we deprive of something. When we satiate, we're giving too much. We have too much. We don't want any more. When we're deprived, we're not getting enough. We didn't receive enough. We want more. So as it relates to motivating operations, when a client does not receive enough of something, we are looking at deprivation, B. Motivation is just too broad here, right? We're talking about motivation. Deprivation is much more specific to this case. And then abolishing. Satiation typically abolishes because satiation means you've had enough. You don't want to do any more. Deprivation is typically going to establish. As it relates to motivating operations, when a client does not receive enough of something, it is considered B, deprivation. Thanks for watching. Please like and subscribe. Check out rbtexamreview.com. Questions, comments, let me know. Love to help. Work hard, study hard. See you soon.